Marcy can attest. I'm very passionate about this, and part of it's just my life experience in medicine and seeing where traditional medicine goes, and there's a good place for that. I'm not, I definitely come from traditional medicine, but I saw just in my years of researching both natural medicine, integrative medicine, and being in the military, we had something called mission readiness and mission performance. And so it kind of occurred to me when I was doing my aerospace medicine fellowship, why, if we're doing this for people to be mission ready for extreme environments and to be high performance, why can't we be high performance? And so then I researched and I discovered this whole group of people, the Institute of Functional Medicine, the American Academy of Anti-Aging Regenerative Medicine, where we're really looking at age-related things, but not before it gets to disease. So we don't have to wait to that. And then also in the research of lifestyle medicine, much of this is really preventable. And so there's, James Gandolfini, only 51, and heart attack and died. At least he was in Italy, probably having a great time, drinking all the red wine that he could. But this is, his life was cut short halfway. It doesn't have to be that way. And we'll talk about some of the good studies that show about that as well. So I like this. Even back in 1895, they had it right, really. It's a bit easier to go and recoup when we're young rather than trying to make up the difference when we're older. Anti-aging medicine. So it's like, what's this anti-aging medicine thing about? Why have an anti-aging doctor come and talk to me? But it's really about early prevention, detection of age-related decline, but it doesn't say disease. Because right now, traditional medicine is set up to wait till you get the diagnosis of disease, which is also how the reimbursement system is set up, which really just sort of indoctrinates that even further, how providers and physicians behave, even though many of them may understand or know these principles. It's just not what drives our behavior. The other part about that is regenerative medicine. How do we repair? That's the part that keeps us young. A lot of times people think of stem cells with this, but we don't need to wait till they're going to put stem cells into your body. All the things that we're going to talk about today help to improve your own stem cells to make you young and healthy and regenerate like you should. Three of the major areas that we do that with is with hormonal balance. Hormonal balance is intimately related with your metabolism, health, and wellness, and that actually stimulates your stem cells directly. Lifestyle medicine, we'll talk about that. What we eat, what we do, how we exercise, when we sleep, how much we sleep, what our stress is like, and how we handle it. And nutraceutical medicine. So nutraceutical is kind of a new term, which basically is high quality supplements that are made like pharmaceuticals grade. So they're purity of product, they have what they say they have in it, and they can improve the effectiveness of that. So that's what we're about. There's a lot of stuff in the lay literature. If you've ever done a literature search or internet search on a lot of these things, Google weight loss, oh my God, there's a billion hits that you'll get. There's a lot of stuff out there, but we look for what's the science behind all that. And so when people come, we're integrative. So it doesn't matter if it's a drug or an herb or a supplement. If it has the best science that shows that it's going to help with the least side effects, that's really our goal. That's what we want to do for you. So it's really amazing that life expectancy in this country has really doubled within less than a century. So that is an awesome thing. And a lot of that is due to traditional medicine. Okay, it's sanitation, it's vaccines, it's public health and care. Much of it is on the front end, the prenatal care and survival of babies. But then a lot of it is actually on the back end, the last few years of life. So this is how I think about where people are in their curve for the health span. Okay, it's not just a lifespan, it's a health span. And so the first part of life, we're growing, we're developing, and then the middle part really should be vitality. And so how short or long that is depends on you and what things you do, and less amount on any magic pill or medicine that I can give you. And so the top of that curve is optimal health. This represents a reserve. So this is what most of what we've seen lately with medicine in the past few decades. We've extended a lot of times that morbidity part of life. And this is the ICU phase of life. This is the nursing home phase of life. We could save billions if we just shorten the amount of nursing home care by just a week or two. And so I think we can do much more than that. This is what we're looking for, vitality extension. So we want to take that vitality part of life and make that longer. And I don't know about you, but I don't want to die slow death in a nursing home from Parkinson's like my dad. I want to be out, I want to be rock climbing, I want to be, I want to do something, and then when it's time, it's it, I die in my sleep, I'm 99, I've done everything that I want to do. That's how I want to do it. So, at some point in our life, we transition from growing to aging. So we all probably age about the same rate until we're about 30, and then it starts going all over the place. That's when all of our lifestyle things probably start to catch up with us. But that doesn't mean that you can't change it. So if you're 40s, 50s, or 60s, that those things can't change. You can absolutely change it with lifestyle. We talk about something called biologic age. And so we're chronologically a certain age. We know that about a calendar. But you can be the same chronologic age, but you can have a vastly different biologic age. And there's several ways that we can get at trying to measure that, and there's lots of ways we can get at trying to make that younger. So the aging is normal. So when we talk about anti-aging, don't misunderstand. I can't stop aging. I don't really reverse aging. What I'm dealing with is the rate of aging and the ability of the body to repair itself. And so there's also a difference between normal and pathologic aging, because sometimes even your doctor may tell you, well, you're kind of getting old, so you're supposed to retire. Or, my knees hurt, well, you're getting to be that age, and so maybe that's okay. Or I'm really having a lot more wrinkles, or, that's supposed to be okay because you're getting, no. I don't accept it. I accept it less the older I get. It doesn't have to be that way. And so really our lifespan, our health span, depends on what we're doing with our life and the interventions that we do. So these are a few studies, just a few of many, about lifestyle medicine and how that affects you and what you can do to prolong life and also decrease disease and morbidity. So this was a study done by a Harvard professor, and they looked at all-cause mortality. This was actually in women, but they've done it in cohorts with men and women. And they associated reduced 55% all-cause mortality, 40% of cancer death decrease, and 72% of cardiovascular death by doing 4 things. There's not a medicine in the bunch. Not smoking, right? That should be a no-brainer these days, right? We're really making good headway with that. Maintaining a healthy weight. BMI less than 25. So right now, we know that 2/3 of America is either overweight or obese. At least 1/3 are obese with a BMI greater than 30. And this is talking about a BMI less than 25. Regular physical activity. Most days doing at least 30 minutes of something aerobic and resistance training. And then a healthy diet. Which when they talk about healthy diet, really they're talking about something that's like a Mediterranean type of diet. Lots of fruits and vegetables. Low glycemic, not a lot of sugars. Good fats, red wine. Yes. Some, enough. And that's really what it's about. So that sounds simple, right? But we're still not doing it. This is just graphically. The more risk factors you increase, the mortality goes up. And so this is mortality, but also morbidity. So as I tell my mom, who's 78, and we're talking about there are worse things than dying. And the worst thing would be like to have a stroke and have to have me take care of her for the next 20 years. For both of us. Mediterranean diet. So this is another one looking at 10-year mortality. And this was actually looking at 70 to 90-year-olds. So it's never too late. But this is looking at an older age group. And they still showed a 50% lower rate of all-cause mortality by doing those things. Up here they are again: diet, physical activity, smoking, and alcohol intake. Initially in that study, if you had 0 intake, that actually increased your risk a little bit. If you're a man, you had 2 drinks. If you're a woman, you had 1 drink. Then your risk went down. But then if you went above that, then your risk went back up. Now, red wine, I would assume. And this is just graphically, more people were alive at the end of 10 years that did those things. And incrementally, if you just did 3 of those things, you didn't live as long. If you just did 2 of those things, you didn't live as long. If you just did 1 or you did none, then you're at the literally bottom of the pile. So lifestyle medicine, so that's why I'm so excited about it. There's so much we can do with that and help people and do life coaching that doesn't involve having to do any kind of medicine with any kind of side effects that's going to have potential downside. So I'm sure being here, you're all been learning and talking about how do I do this business better? How can I be a better person, be healthier from this standpoint? But it affects our productivity. So if you look at it from another aspect, it's a business strategy. because health and longevity affects productivity directly. And in fact, in these studies here show that it actually affects your bottom line more from the productivity loss than it does from anything that we put out as far as medical or pharmaceutical expenses. So we think about that. We think that, oh, it's going to be this, and it's going to be the heart attacks and the cancers and those kind of things. But look at the top one is back and neck pain, depression, fatigue, chronic pain, sleep problems, high cholesterol. I mean, this is like my top 10 list of what I do in my practice and what I see now. So if you look at that graph, 4 times the amount of productivity cost than what you're going to spend for medicine and pharmaceuticals. So it's not a personal thing, it's a business strategy as well. And let's look at the total cost. Again, that's that list of things that if you look at my